Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing just well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, infectious disease, and public health questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering a viewer-submitted question, addressing the latest headlines, and our lone U.S. COVID statistic through today, June 12th. We invite you to submit any questions you have down below or via any of our social media linked in the description. Starting with that brief abbreviated COVID statistic, average COVID deaths per day in the last reported week were down to 38 daily. In the same week in 2024, we saw 61 daily COVID deaths. Dr. Murphy, your reactions to those numbers?
Well, they're pretty much the same, drifting down maybe just a little bit over the last couple of months. And it's always good to look at what happened the year before, and we can see that it's significantly lower than a year ago. So this is kind of our typical peak that we see in June and July. And then, as we saw with Delta originally and every year since COVID came out, there's usually a peak, a summer peak in August. Not sure really why that's happening, but we'll see what happens this year if that does jump up.
And is there any news in changing wastewater or viral strains that we're seeing?
No, it's pretty low all around. There's not seeing much in the wastewater. There's no big signals. This is like the down part of the curve. So everything is kind of fitting into place right now with what's an expected pattern.
That is good to hear. What is more distressing to hear is a very big story from just earlier this week, a few days ago, in that the Health and Human Services Department here in the US has removed all 17 members of the CDC's Advisory Committee on Immunization Practices. Can you tell us who those people are, what they do, and what the consequences of this could be?
Well, to abruptly just remove the entire committee is really short-sighted. These people are highly respected academics. They are vetted, and they cannot participate in this committee if they have conflicts of interest. And they're not allowed to be working or funded by pharmaceutical companies. Even their institutions can't have significant funding from pharmaceutical companies that manufacture these vaccines. To quote the chair of the American Academy of Pediatrics, it's an unmitigated public health disaster because you have a group of very knowledgeable people who've been around for a long time, who are very highly respected. And there is no conflict here. Let's get that straight. What has been reported is 97% of the members have conflict. This has nothing to do with it. That's like when you fill out a conflict of interest form, it's actually quite complicated. You can mix up a date or have something missing or something like that, but it is not a conflict with the pharmaceutical companies, which is what everybody is worried about. So that's just a ruse, an excuse to just put basically anti-vaccine people on this committee. So it's really going to be, it's really not going to be good for the country.
Yeah, very distressing news, and we will keep you all updated on anything we hear coming out of that camp, any further progress.
I mean, this is happening throughout the system here in the Fulbright world, the Fulbright scholarship world. The same thing just happened. 11 out of 12 of the members of that committee actually resigned because they were being bullied into selecting certain candidates or another. These are international people for the most part. There are Americans too, but the same thing is happening with all these advisory committees.
It's a scary thing that's going on there. And something else coming up that could cause more global problems is in the latest proposed budget for our federal government here in the United States. There are even more suggested cuts to some of our global vaccine and health programs. Can you tell us what those are?
Well, there's a proposal, it's in Congress now, to eliminate the whole global vaccine funding program. It's $230 billion a year. Remember, diseases are global, they're international, they don't know any borders. People travel a lot. So it's important that we stay protected when we do travel. Of that 230 billion, 180 billion goes for polio eradication, which is also funded by the Gates Foundation. It's funded by the Rotary. It's funded by some other governments, but the US has a huge chunk, 230 billion total and 180 for polio. So what this could do, according to some of the global people that we work with, the scale, scope, and abrupt nature of this decision is going to lead to more disease and death, and probably a global resurgence of polio. So not only when you travel do you have to worry about everything else, but you're going to have to worry about polio again, which was really close to being eradicated. Pulling the plug on polio right after all these years of getting it done. I mean, polio is a potentially eradicable disease, like smallpox. So yeah, we really hope that this was going to be the case, and it looks like we're going to go in the opposite direction.
Very unfortunate. And we have reported on small numbers, 2 to 4 cases of different types of polio all over the world in the past few months, actually, but nothing to the scale that we could see if this really does resurge.
Mhm.
Now, we do have a submitted question today. It is about the COVID vaccines and some of the fall vaccine coverage we have been following. The question is there a deadline for the pharmaceutical companies to choose the variant that the vaccine will target? And what is that time frame?
Yeah, well, the time frame is a couple things. One is how long it takes to manufacture a new vaccine, and what's going on in the Southern Hemisphere, because the respiratory seasons are flipped in the Southern Hemisphere versus the Northern Hemisphere, obviously, because it's weather related. So those two things are very important. So we typically pick the what to target the vaccine for. This goes for the flu as well, by the end of May. So that's passed. So they have picked, and as we said at the beginning, we are now getting taken over by the NB1.8.1. It's now that variant is now up to 37%, and the older variant is now dropping. Now, the current vaccines and the committees that advise on this particular question told the companies that they should target LP 8.1. That's the one that's kind of going down now. It's very closely related to the new one that's coming up, so it probably is going to work. It's going to work better than what's out there. Let's put it that way. So the one difference is the Novavax vaccine, which is the more traditionally manufactured vaccine. It takes a longer time for that to be adjusted. So they're still making the vaccine for the JN1. That's the one before the LP 8.1. But again, they're all in the same family. It should work. But if it was me wanting a vaccine, I would want the one that was the current one. So I know there is a European company that's targeting that, but I think for the US, we're going to live with the 8.1, and that's going to be better than what's out there. So in the fall, and the respiratory season picks up again, you get your new flu vaccine, which will be brand new, and you get this new one, the 8.1.
Yes,
Or
and
if you go,
ironically,
you're gonna be with the old one.
mhm. And
But
ironically,
anything is better because the effectiveness of the vaccine does wane over time. So you're gonna need a booster no matter what.
mhm. And ironically, we were just reporting on some of these advisory committee meetings of that immunization practice committee we were just discussing at the top of the episode, approving these vaccines, going through to see which strain we should target. So luckily, we are on track with that timing.
Right.
Now, another interesting tidbit about the respiratory season that just passed is that it seemed like RSV, respiratory syncytial virus, ended a little bit earlier than it usually does. Can you share those numbers?
No, they're just down. The season was shorter than expected. So, it's a very dynamic process, and it depends what else is going on in the respiratory world. And, it's just a dynamic process. It's still going to come. It ended a little early this year. So, I mean, that was good, but it still came and caused a lot of damage.
Mhm. And one of the other respiratory illnesses that was also causing a lot of damage last year and this year is whooping cough or pertussis. There was another warning about rising cases. Can you share that with us?
Yeah, so PAHO, the Pan American Health Organization, which we're still part of, has pointed out there's some really serious vaccine gaps in pertussis, whooping cough. And these gaps have really caused a huge increase in the numbers throughout the Americas. In 2023, there were 4,100 cases reported. In 2024, this jumped up tenfold to 44,000 cases. Of those 44,000, over 10,000 were in the United States, which accounted for 5 deaths in children ages 8, mostly 11 to 19. So you can get sick, end up in the hospital, and die from whooping cough, another completely preventable disease, basically, with the appropriate vaccines. But this gap in the vaccines is going to drive more and more of these cases.
Mhm. And speaking of lagging vaccine rates in general, the measles outbreak, which has been largely associated with those who are unvaccinated or of unknown vaccination status against measles, continues to rise here in the United States. Can you tell us those new numbers?
Yeah, so we're up to 1,168 cases with 3 reported deaths, 2 children and 1 adult, none of them vaccinated. And Texas is kind of flattening out in the number of cases. That was the center of this in West Texas. But it's other states now that also have these big gaps in people who are vaccinated. So it's going to continue to spread like that. So Texas has clamped down. They've also had an uptick in their vaccine uptick. And that will help them as well. But now it's spreading to other areas as well. Remember, measles is a highly contagious disease. So the CDC has recommended now for travelers, if you're going outside the country, the vaccine gap is even bigger in many places, that you should make sure you're immunized against measles. You either had measles in the past, you had the vaccines in the past, 2 doses, or you get vaccinated before you go. That's the recommendation, because you could come back with measles. I remember when I was treating a lot of people in the hospital, I remember the sickest patient I had at one time was a 64-year-old person who had come back from a high-risk area in the Caribbean and had a very atypical measles presentation and almost died. And we like were investigating for cancer and all these other unusual things. It was all measles. It was just a terrible case. So, but that's the recommendation now. Of note, from the epidemiology side, 78 counties in the United States are seeing a significant drop in the vaccine uptake overall. Even though all this is going on, the vaccine rate is going down. And, measles doesn't care, I mean, if you don't have the antibodies, you're going to get it, basically.
Yeah, and important to note, 2 doses, a full vaccination series of the MMR vaccine is 97% effective in preventing disease. So really, really important
Not only
there.
preventing disease, but preventing severity. Yeah.
Absolutely. Speaking of severity, unfortunately, globally, there has continued to be human avian flu cases, most recently in Bangladesh. Can you tell us about those cases?
Yeah, they reported two avian flu cases. The people are surviving. They're doesn't look like it's going to be a fatal condition, but two more cases of avian flu in these cases. Of note, just to bring everybody up to date, nothing really much has changed. 173 million birds have been culled in the United States, 1,000 dairy herds have been infected, and 70 people have been reported to be infected. That's a way underestimate. And there has been the one death. Of note, though, because in places like Cambodia and other places we've talked about previously, the mortality rate is as high as 50%. So, we don't understand why the mortality rate would be so much higher in a different part of the world, but that's why everyone is nervous about avian flu, that it's a higher mortality than the current flu. And there are vaccines for avian flu. Moderna had made a vaccine and had a $766 billion contract to actually ramp up their production in case it does spread into the human population. And that contract was just canceled. So that's very unfortunate because, of course, when you know how fast flu can spread, if this thing changes, it mutates, which a lot of people think is very possible that, if avian flu is out there, I mean, it's hard to even get a test. You can get one, but it's not that easy. And I mean, this thing could really take off and would need millions and millions and millions of doses. And, kicking Moderna out of this at this particular point is very short-sighted. This is an
Short-sighted.
insurance, basically.
Yeah. I mean, imagine if we were able to have scoped out and developed a COVID-19 vaccine before it had spread to a large-scale human population here or elsewhere. It would have made a massive change.
Yeah, I mean, we know what the virus is. We know how to make the vaccine. I mean, it's a matter of time and money.
Mhm. Our final story today is on something that's a little bit lesser known to us in the northern part of the United States here, and that is U.S. Valley fever. Can you tell us how many cases there are of this illness, what it is, and why we're talking about it?
Yeah, people in the Southwest, they know valley fever because it's a pneumonia that is caused by a fungus, coccidiomycosis. And for instance, typically you'd have a few thousand cases per year and a few deaths. However, what they've noticed over the last few years is that the number of cases has jumped up 10 to 18 fold. So that's a big jump. And that resulted in last year 28,000 hospitalizations and somewhere between 700 and 1,100 deaths. And a cost to the medical system of over $350 million. So it's in the Southwest of the United States. It's typically associated with soil that's been turned up, dust storms and the like. It's also in Mexico and the rest of the Americas. They have it as well. And they've done some modeling analyses, epidemiological modeling analyses, looking at antibody levels in people. And probably that what we're reporting here is only 1/10 of what's really out there, and that there's really almost 300,000 cases per year. Some of the people get it, they get a very mild pneumonia. Obviously, some 28,000 ended up in the hospital and about 1,000 died. So it's a very serious disease if you're in the Southwest part of the United States.
Very serious indeed, and something for us to keep our eyes on in the future. Lots of
Mhm.
gaps there. But thank you very much, Dr. Murphy, for joining us all the way from overseas for this week's episode. It's much appreciated.
Well, thank you, Katie.
And thank you all for joining us for this week's episode of Ask Dr. Murphy. We hope you enjoyed. If you have any questions or comments, please leave them down below or at any of our social media linked in the description. We'll see you next week and have a lovely weekend.
See you next week.